Hi, everyone, and thank you for joining us today. My name is Stephanie Doback, and I'll be the moderator for today's discussion titled Life with ALS, Caregiving, Chaos, and How Dietitians Can Help. I'm excited to introduce our speaker today, Wendy Wilson. Wendy is the owner of Array Nutrition and Lactation and a passionate advocate for both nutrition and ALS care. She holds a Bachelor of Science in Nutritional Sciences from the University of Oklahoma Health Science Center in 2015 and became an international board certified lactation consultant in December of 2020. Wendy spent 4 years at the Oklahoma City County Health Department's WIC program before taking on the role of full-time caregiver to her husband, Michael, who was diagnosed with ALS in 2017. In 2022, Wendy launched her private practice to support her family and stay connected to her professional roots. She has become deeply involved in the ALS community, serving on various leadership councils and committees, including the ALS Association's Community Leadership Council and the Patients and Caregivers Together Committee. Wendy and Michael are dedicated to supporting the ALS community, regularly participating in ALS support groups and Oklahoma's biannual ALS boot camp to share their story and offer support. Through her unique blend of clinical expertise and lived experience, Wendy hopes to empower dietitians and caregivers alike, offering practical insights and advice on ALS nutrition. She believes in the power of connection and humor because sometimes a good laugh is just what you need on this journey. So at the end, given that this is a discussion, we'll have a time for Q&A, but we want it to be really interactive. So we'll ask if you feel good about it to take off your camera, to unmute yourself, and we'll just have a really good discussion with Wendy. And I'm going to put the CEU certificate in the chat box for you to be able to download. At the end, we'll have our typical 4-question evaluation. So we ask that you complete that. And then lastly, as always, we want to thank the ALS Association for providing the Quality of Care Program grant to support this presentation. And with that, I'll hand it over to Wendy.
All right. Hello, everyone. As Stephanie said, I'm Wendy Wilson. I'm a registered dietitian and a caregiver for my husband, Michael, who was diagnosed with ALS in 2017. Conflicts of interest. I was a paid member of a patient committee for an ALS FRSR study conducted by RTI International and the FDA. I plan on spending about 15 to 20 minutes kind of giving you a glimpse into the life of a caregiver. And then we'll follow that up by discussion and Q&A. But if anybody wants to jump in and ask a question in the meantime, that's totally fine too. Here are our objectives for today. And I wanted to take a minute to kind of set the mood. Michael and I decided early on in our journey that we wanted to enjoy the time that we had left together for our sake, but more importantly, for our daughter's sake. And so we have tended to focus on the positive. And while we're very open communicators, we still from time to time find ourselves shying away from sharing negative feelings with one another because we don't want to burden each other or disrupt our positive atmosphere. However, every single time we do this or kind of hold in those negative feelings, they kind of build up and pressurize and they start affecting other parts of our lives. And so like what that looks like for me is I'll get to a point where I'm just constantly weepy and constantly trying to hold myself together. And it makes it so hard to focus on anything else. And so it wasn't until really recently that I learned that there was a term for this called toxic positivity. And basically, it's just insisting on maintaining that positive outlook in all situations, even if it's not realistic or helpful. What this can sound like from other people is, oh, just think positive or everything happens for a reason. And those statements can make people feel guilty for having those negative feelings and kind of dismiss them. And so we really tried to find a balance in our house as far as, keeping that positive atmosphere, but sharing those negative feelings in a timely manner, because we find that when we go ahead and get it out there, we're able to get back on track, get, pull things together a little bit more effectively and more quickly. And so that balance is what I'm going to try to provide today in this presentation. So both Michael and I are the first people in our families to go to college. So we were studying at Oklahoma State University when Michael stepped out of the shadows and helped me with the daily crossword puzzle in the college newspaper. And then 2.5 years later, I found him waiting with a ring at the end of a very thoughtful scavenger hunt. And then we got married on our 3-year anniversary, and 6 months later found out our daughter was on the way. So we were busy raising our daughter, getting our careers underway. I had gone back to school to finish my degree. And in 2014, Michael's father had spent 3 months in the hospital and ended up passing away. And around that time, Michael started having these constant fasciculations, and it was in like the large muscles of his body. And we thought it was just the stress of losing his dad. And, we thought it would go away once things calmed down a little bit. And when I say fasciculations, I mean, we would like lay down to go to bed at night and it would be so strong, it would be shaking the bed. So he did eventually go to a neurologist to, see what was going on. And they had diagnosed him with benign fasciculations. So there was no evidence that there was anything beyond that going on. But we had to keep going back every 3 months to just monitor for any kind of changes. Google had already told us that ALS was on the table, but that diagnosis of benign fasciculations kind of eased our fears a little bit. I went on to graduate in 2015 and started working at WIC that following year. And so we finally were at a point where we had the income, we had the free time to begin taking dance lessons as a family, all three of us. And it got to a point where our dance instructor kept getting on to Michael because, the lead has to hold the frame of the dance. And so she kept getting onto him because he couldn't hold his pinky up with the rest of his fingers. It kept falling down. And so that was the first signs of atrophy that we had been dreading. And it started the whole process of trying to diagnose ALS. So you can kind of imagine the roller coaster that is, maybe I think there's something wrong, maybe there's not. No, I really think something's wrong, but let's not think the worst. It was kind of a very back and forth, up and down kind of time. I think if I'm understanding correctly, I think most of us work in an ALS clinic, and so you're pretty familiar with this, but ALS is a diagnosis of exclusion. So you basically have to test for all of the other things that could be causing these symptoms before you rule all those out, and then what's left is ALS. What this looks like is MRIs, EMGs, the lumbar puncture, genetic testing, what seems like 500 billion vials of blood. And of course, it can't all be done at once to rule everything out. They just rule out a few things, and then you just go back for more testing and rule out a few more things and go back for testing. And so it can be dragged out for months, and for some people, years. People are often misdiagnosed too. So that can result in unnecessary surgeries and procedures, which further prolongs reaching a diagnosis. And in some cases, those procedures seem to speed up progression. I will say during this time, it really makes you question your sanity when you and your spouse find yourselves hoping, you get down to 2 different diagnoses and you're just hoping for this other one because it only causes sexual dysfunction. Whereas, it'll at least give you a chance to live with the person that you hoped you could live with. We received Michael's initial ALS diagnosis in February 2017. And the shift in perspective that comes along with that it's changing. For me, I was very much a play it safe, don't take chances kind of person. And so like I would never want to take a trip away from our daughter because I felt like it was increasing the risk that something bad could happen to her, or what if something happened to us and she was left alone. Like, I just didn't want to leave her by herself. I always felt like we could wait until she was older and then we could go and do things. But with this diagnosis, it kind of changes things, because you're like, well, you know what, this may be my only chance to get to do this. And so I took a trip with Michael for our first time alone, with, after the birth of our daughter, um, because, like I said, you feel the full weight of the phrase "life is short" at that point. With the long road to diagnosis and then the frequent misdiagnoses that often result, it's very common for people to seek a second opinion once that initial diagnosis is reached. And so, depending on where you live, this can mean traveling to a different state, writing letters to insurance to ask them to cover it, and just having to justify why you're going to go get the second opinion. Maybe it's approved, maybe it's not, but you can imagine how, like, that second opinion can kind of make you hold out hope for, maybe this really isn't happening. So we did just that. We made a big family road trip out of getting our second opinion at the Mayo Clinic in Scottsdale, Arizona. And prior to this trip, we had reached out to a counselor and a child life specialist at the local children's hospital, because we needed to figure out how to tell our daughter, who was 7 years old at the time, how do we tell her that daddy's sick? And, none of us want to be the reason our kids need therapy. And we really didn't want to mess this up. So we got some really great advice from them, as far as, be honest, tell them what's going on. You don't want to keep it from her, because oftentimes kids are going to know something's going on. And if you don't tell them, then they'll kind of fill in the blanks with their imagination, and it could be way off base, or, way worse than what's actually happening, if you can imagine. And so they said, just be honest, give age appropriate information, try not to give too many scary details, and make space for questions. And so, we did it. We said all the things that we wanted to say. They had also warned us that at her age, kids are very self-centered. And when they told us that, we were like, nah, not our baby. But whenever we said all of the things that we had planned to say, and we asked her if she had any questions, she was sitting there and she was like, so I get to see the Grand Canyon? Was her only response. So we were like, okay, glad we had prepared ourselves for that kind of response from her. So we made a lot of hilarious memories on our second opinion trip, some of which are depicted in these pictures here. And if we have time at the end, I'll be happy to share those with you. So we get our second opinion, and it confirmed our first diagnosis, and boom, that it's real. It's everything that Google has told us is going to happen is about to happen. We have 3 to 5 years left with Michael instead of the 60 we had dreamed of. We're about to watch him slowly waste away, lose the ability to breathe, and then he'll be gone. So, in one word, shook. It changes your world. We were trying to set ourselves up and do all of the right things so that we could live the lives that we wanted to live. And we were just getting to the end of the bridge that we were building to that life, and the bridge just crumbled underneath us. All of these questions start going through your head, like, what does this mean for our future? What does this mean for our daughter's future? What will Michael have to go through? I know I can get through this, but I hate this for Michael. I hate this for my daughter. I know we can get through this, but how do we get through it semi-okay-ish once Michael's gone? Some of these things are a part of anticipatory grief, and it's exactly what it sounds like. That's another term that I didn't know existed until we started this journey. But it's basically feeling the loss of a loved one before they're gone. And on one hand, it can be very beneficial. It can help you kind of emotionally prepare for the loss before it comes, and kind of work through those difficult emotions. But there are also drawbacks to it. It for me, I feel like I have a completely different brain now because um, I have memory problems. It's very hard to focus, uh, things that I didn't have problems with before. But it can definitely feel you kind of left or stuck between holding on to your loved one and letting go. And it's a very weird place to be in. Um, I have some stories to illustrate that, but again, I'll share those for the end. But along with this earth shattering diagnosis and just complete change in perspective comes a to-do list from hell. Looks a little something like this. So, the first thing that a lot of people are told is to get their affairs in order. And Michael was 34 when when we were going through this. And so, we hadn't thought about putting a will together, or we hadn't thought about half of these things. But, you immediately have to figure out all of these different treatments and equipment that you have to get, things that you've never heard of before, like a cough assist, or figuring out what you need for your power chair, and modifying your home or getting a vehicle that can accommodate this equipment, figuring out how, if insurance is going to cover it, and if not, how to go to bat for yourself. um, you know are there clinical trials that we can be involved in? The sleep that you lose, not just from the stress of everything, but then also once your loved one gets to a point where they can't adjust themselves at night, you have to wake up and help them move. And then thankfully, I'm really good about just going right back to sleep. But sometimes it can be at multiple times a night that you have to wake up. And then care planning. A lot of facilities will not accept someone with ALS due to the level of care that's required. And so it's often just left on the families to figure it out. And, you know, it, you can't, at, at the beginning, usually you can continue to go to work, but at some point they're just not, it's not safe for them to be at home by themselves because they can't get to the bathroom, they can't eat, they can't cough to clear their airway. And so oftentimes loved ones will have to stop working, and they have to adjust financially, because for us, it was not just one loss of income, it was the loss of two incomes. And so, trying to figure out how are we going to get through with all of this. And then on top of all that, just trying to maintain as normal of a life as possible, because again, we don't want this to change our daughter's life significantly for the negative. We want to come out on the other side of this okay. Another aspect of the journey is you're kind of thrust into this constant cycle of adapting and adjusting with each new progression and each loss of ability. You have to figure things out all over again. These pictures here kind of show the progression of Michael's walking. In January 2017, he was walking without any assistance. And then by June of 2019, he was using AFOs to help with the foot drop. And he also used a rollator at that time. And for long distances, he would use his chair. But then by June of 2020, after 3 scary and significant falls, I said, okay, I'm drawing the line. I need you to be in your chair. So that's when he was in his chair full time at that point. But the biggest goal is to just try to maintain connection with the outside world and as much independence as possible. And so that's what we're constantly trying to do for him. These pictures show the progression of the loss of his arms and his hands. So in April of 2017, he was able to pick the nose of the statue. In that middle picture, he was making a smoothie. It was his famous smoothie. And I remember taking this picture. He was barely holding on to that glass, and he could not lift it any higher than that at that point. And then by November of 2018, he essentially had no meaningful use of his hands. He could drive his chair around, but that's about it. And so, he's no longer able to feed himself or brush his teeth or bathe himself. And so all of those things come, we got to figure out how we're going to do this now. This shows the progression of his breathing. Um, at first he had to sleep propped up. And so he ended up sleeping in the living room until we were able to get some adjustable base beds to where he could move back in the bedroom so we could still sleep together. But he got to a point where, laying down at night, he would use his ventilator only then. And then as of November of this last year, he's been wearing his vent more during the daytime as well. So with all of this, we know that overwhelm is the enemy of behavior change, or implementing new practices. And so that's where dietitians can come in. We're already trying to figure out how to do basically everything over again. And so if there are new recommendations that you're bringing up to them, trying to make sure that the caregiver is comfortable with it. If there are ways that other families have implemented this or made it work for them, have that list available so that we don't have to reinvent the wheel. Asking those open-ended questions, facilitating access to whatever supplies, instead of just saying, hey, there's this thing that could be helpful, say, here's this thing and here's how you get it. Do you want me to help you do it? I just recently learned about medically tailored meals that some insurance providers make available. It differs from state to state on who's eligible and stuff like that, but looking to see if that's something available in your area for people. For each person that has ALS, there's probably just as many different perspectives on everything. And this is where your counseling skills are going to come in big time. Ask permission to ask, explain why you're asking these questions so that you can understand their particular situation and what their goals are, so that you can individualize the care and recommendations that you're giving. But the outlook is so different. Everybody's going to have their own cocktail of positive and negative feelings going on at any given time. And that can make the difference between being able to laugh it off when your loved one locks themselves inside the van and has to make out with the door controls to try to unlock it, or breaking down in panic. But some people see value in taking all the medicines and sell their homes to try to do everything. And then there are other people that just want to coast through and take more of an end of life approach. Same thing with like healthy lifestyle. Some people are not going to care less about their added sugar intake or saturated fat, but there are families who have kids in the home like us, where we're still trying to model those behaviors that we want her to develop. And so that is still important to us. And you're not going to know unless you just ask. And whenever you ask permission to ask, if the person says no, not right now, just say, hey, is it okay if I check it back in with you in a couple of months just to see if this is something that you're ready to focus on? So just checking in, using those counseling skills. Building that community, knowing what organizations are available in your area, what services they provide, how to connect people with those services. Peer support is huge. We have our support groups that we go to pretty regularly. It took us about a year to decide that we actually wanted to do that. But once we did, we have not looked back. It's been huge for us. We just recently, well, since COVID, started having our support groups at a restaurant, which I was a little hesitant about because I was afraid that people that were on tube feedings would not find that an enjoyable experience, but we have found quite the opposite, actually. It's so awesome when we can see people kind of blossom and feel more comfortable with going out, and seeing, me feeding Michael and they're feeling more comfortable with going out. This can be a huge source of isolation for people because they don't want to go out and be seen as other, or, feel weird. And so seeing that we do it, and we had one gentleman walk in and like gasp, and he was like, wait, can I have a margarita? Like, he was totally floored that he could still have a margarita. And we're like, dude, yeah, have a margarita. So getting out, having that peer support, seeing what other people can do is so important. And then Stephanie mentioned the boot camp that we have in our state. Michael and I have started having a table there called Ask Us Anything. ALS affects all facets of life. And so we welcome anybody to come up and ask us how we have navigated certain things. And I just want to extend that to you all, beyond this presentation or this discussion today. If questions come up or you want to brainstorm different things, I'm totally okay with people reaching out to me and being like, hey, how do you do this? Or what have other people done about that? So yeah, don't hesitate. I might not get back to you like today, but I will eventually get back to you. Just a few final quick tips. These little mouth toothbrush trays, a lot of people in our area tend to like those. Once you can't bring your hand up to your mouth to feed yourself, you also can't brush your teeth. And so this is something that people have really found helpful. The middle one, I would say this is the biggest one. It took us, we're coming up on our 8-year anniversary on this journey. And it wasn't until maybe within the last year that we realized we could use the cough assist to blow Michael's nose, because he loses that power, that strength to blow. And so it was really difficult to clear that airway. And whenever you're stuffed up trying to breathe through your mouth and eat at the same time, that just really increases your risk of choking. So letting people know they can blow their nose. And then the Think ALS tool helps, with that misdiagnosis. A lot of people see other providers. And so like other neuro focused providers. And so that tool can be an easy thing for us to use and get people to the right people so that they can get a timely diagnosis. And with that, any questions?